Hi, Dr. Ferreira.
Hey, how are you? How's it going, Christy? Everything good? Can you hear me well?
Yes, perfect.
Yeah, we can hear you.
Perfect.
Uh,
Nice.
all right, brain turns. It is 11 o'clock, so we're going to get started as Dr. Ferreira is here. Hannah had said that Dr. Ferreira, he's from Brazil, so all of you international students will enjoy this talk. And he actually just completed his Cerebrovascular Surgery Fellowship at Lenox Hill just this year. So the floor is yours, Dr. Ferreira.
Yes, thank you very much. It's a pleasure to be here. I'm talking to you guys from Brazil, and try to share my screen here just a second. Okay. All right.
Is it letting you share? Oh, there we go.
Okay.
Yes, we can see it now.
Perfect. So pleased to meet you all. It's a pleasure to be here with you guys and try to go to presentation mode. Okay. So this is just a quick peek on my pathway to neurosurgery and Lenox Hill Hospital, and how it's changing my life right now, and all the experience I've been this year that I got this year was an amazing experience, and it definitely was worth it. All that happened in my life. So this is a quick review. This is a old picture with me, this little boy with long hair, using the Lakers t-shirt on the right and the left side of the screen. I was about 78 years old there in that picture, and with my two brothers, my older brothers, and Damian, he's is the tallest one of the screen. He's about 7 years old, older than me. Fabrício is the other one, and that's my grandfather, Eduardo, and he passed away a couple years ago. And this guy was the most important guy of our family. He was the one that changed the plan and started doing all of these efforts to get us involved with to show us the world and to promote our adventure side on us, to try to go further, to discover life and to go to other places. So for you guys that doesn't understand a little bit of that, it meant a lot to me because my brother, he was the first physician of our family, and this is a picture of me operating with him, and he definitely influenced me a lot in my career and what I when I and it represents a lot to me where I'm right now because of him. So for you guys that don't know Brazil, so Brazil is a huge country. We are today the eighth economy of the world. There's a picture comparing Brazil to United States. You can see how big is Brazil, and we have 220 million people living in Brazil. And just a second. And Adriano, for that because I'm in my house here. So sorry. And to come back to this picture. So Brazil's eighth economy of the world, but unfortunately, oh my God, I have to change places here. Just a second. Adriano,
While we're waiting on Dr. Ferreira, if y'all want to go ahead and as you have questions, make sure you're asking in the Q&A chat and make sure that we are being respectful in the chat. Wait, Dr. Ferreira, if you could unmute yourself. Sorry, could you unmute yourself? Let me see. There we go.
sorry for that.
Very
So
good.
let's go back. Can you see my screen again?
Yes.
Okay, so but the problem with Brazil is, besides being the eighth economy of the world, we're still a third world country. You can see right here the stats of our education status in Brazil. We're all this is the Organization of the Economic Cooperation and Development. There's the biggest 38 countries in the world, economically wise, and talking about, and we can see that the Brazil has one of the lower scores in the education performance in reading, mathematics, and science. We do have 99% of our children in school, but unfortunately, our education is not one of the best in the world. So, but Brazil tries to improve that. You can see in the graphic in the left side of the screen, that is the total spending on education. And you can see that a percentage of the GDP that is spent in Brazil in reading, in education, is about one of the highest one. You can see almost 6% of the Brazil GDP. But besides that, we still have low scores in reading, mathematics, and science. So it's a challenge in Brazil. Most of the people go to public school in Brazil. They are financed by the government, but we do have not as good as other, comparing to other first world countries. And one of the reasons that probably we spend more and we don't have great results because of corruption and politics and things that are reasons that make Brazil a third world country. So fortunately, I had the pleasure to my fathers and my parents could afford private school for me. So I went to a private school, Mercedes Soares, founded in 1946 in the city of Volta Redonda. Volta Redonda is the city that has the biggest steel company of Latin America. It's called Companhia Siderúrgica Nacional, and it's a wealthy city here in Rio de Janeiro. A lot of people have opportunity to come here to work because of the industry. And fortunately, I had the opportunity to go to a private school. And studying there, I was able to get to med school. And in Brazil, it's pretty different from America, that we can go straight from high school to med school. Med school in Brazil are straight 6 years of school, and you have classrooms like about 44 hours per week of classrooms. Usually the first couple of years you have just the basic science, biochemistry, biophysics, biostatistics, and all the anatomy studies. You start with that in the first couple of years, and then after that, the third and fourth year are more clinical years. Then fifth and sixth year of med school, it's internship. So in total, it's 6 years. So it's a little different than US, and you go to college first, but it's like 44 hours per week, so almost 12 hours per day of lessons. So that's why it's 6 years. And but as you can see here, I have a couple of pictures of me when I was just starting studying on it, and I was like 17 years old. So you can see how young we were at that time. And I think one of the things in Brazil that makes you less prepared for being a doctor, I think, because you're still too young. But you get exposed to all of this important stuff so quickly, and of course it will bring some knowledge for the future. I was finishing my med school, I was deciding what I was going to do and why would I choose neurosurgery. So my brother, as I told you before, he decided to do a cardiothoracic surgery, and he went to cardiothoracic surgery at Beneficência Portuguesa in São Paulo. And it's the biggest philanthropic hospital of the Latin America. And they have more than 1,000 beds in that hospital and 3,000 doctors and a lot of collaborators working in that hospital. And I had the opportunity to do an internship at the neurosurgery service over there. So it was my first contact with the brain. So you can see that picture in 2009 before joining the residency. So that's where I decided to go for neurosurgery. As I told you, my brother was a cardiac surgeon, so I went for a couple of surgeries with him, but I didn't work with my brother the rest of my life, so I changed. I needed to do something different, so that's why I choose to go for neurosurgery. And then I applied for residency, and I got a spot for neurosurgery residency at the Hospital Universitário Antônio Pedro, is a university hospital from the Universidade Federal Fluminense from Niterói. And Niterói is a city close by Rio de Janeiro, and Rio de Janeiro is a huge city, and as you can know, it's a beautiful city. This is a picture of Niterói. You have all the beaches just across the street, so you go to the hospital. But I didn't have that much time. I was working like hell for 5 years. So in Brazil, a residency is also 5 years. So there's a picture of me and my residency colleagues at the end of the day after a long surgery, 12 hours of surgery, but everybody was happy and enjoying that moment. So it was a great time, great experience over there. And one of my co-residents, he had opportunity to do a observership at Baptist Health in Jacksonville, Florida. And so he told me, Christian, why don't you go there too? Why don't you go do an observership at Baptist? So that was my first experience going for that was my first experience going to America and to watch surgeries there. So it was my the first time I saw a biplane. That was, you can see in the right picture over there. It's a angel suite with a biplane, so you can have pictures of the brain on the AP, in frontal view and lateral view at the same time. So we didn't have that technology back in Brazil. It's too expensive. It's still too expensive to have it here in Brazil. Only in some huge places, some private hospitals that you can have that. And but it was a great experience, and it was also my first opportunity to see the bypass. So you can see here it's pica bypass, and that was when I decided I need to be a vascular surgeon, a vascular neurosurgeon. And when I come back to Brazil, I had opportunity. Oh, this is a picture of me with Dr. Ricardo Hanel, who's the director of the Baptist Health Neurosurgical team, and you can see down there the last one is Dr. Adnan Siddiqui. He's the coordinator of the Jacobs Institute in Buffalo. So Ricardo and him were good friends. They both trained in Buffalo. And also Dr. Langer, he also knows these guys, and he trained with them too at Buffalo. So they all came from Dr. Hopkins, who was the first one to adventure in endovascular surgery that got my attention. And I wanted to be a vascular and an endovascular surgeon. So I'll be a hybrid surgeon. So as soon as I got back to Brazil, I started my clinical fellowship in endovascular surgery in 2015. And I had the opportunity to do my first thrombectomy for stroke treatment in 2015. 2015 is a very important year. It was the year that I got married, first of all, and to my beautiful wife, Paula. And after that, I was doing my fellowship. And then in 2015, we had the first randomized trial of intraarterial treatment for acute ischemic stroke. So this is the trial, Mr. Clean, a famous trial that changed the treatment of strokes, and is changing life of many people from 2015. So you can see here, January 1st, 2015 is when it was published at the New England Journal of Medicine. And I did my first thrombectomy 2015, almost 10 years ago. So it's pretty nice to be one of the first to do it in Brazil. In my region, I was definitely the first one to do it. And today the treatment this is the American Heart Association guidelines showing us that since 2015 it's one way, the indications for stroke. So the evidence for that. So you need to do it. If you have a patient with a stroke, the best treatment is to do thrombectomy, is to open the vessel up to 6 to 24 hours, depending of result of CTP, MRI. I think the message here is not for you guys to understand how to treat stroke, but to understand that I was there in the first moment, and I was able to do it, and it was a great experience for me too. So for you guys that don't know how this treatment works, this is a quick video. Probably not the video is not that good because we're doing it online transmission, but you can see that this is how you treat the stroke. You go with the micro wire, you cross the clot, and then you carry a microcatheter, and through the microcatheter you're gonna pull back the wire, and you're gonna deploy a stent retriever. This is the stent retriever. This is like a radiological interpretation, imaging of the stent retriever, how you push it, and you have the working length. It's about the same size of the clot, and then you deliver the stent covering from the bifurcation of the middle cerebral artery to the internal carotid artery, and you can see here the stent opening the threads, and you can restore the flow already because the stent crushes the clot in the wall. And this is just talking about the stent, how the stent can deal with small vessels. And after that, you're going to pull back the clot, you're going to remove the clot, and you're going to open the vessel. So this is the first trial, the Mr. Clean trial, was a thrombectomy trial doing stent retriever. Now we also know that aspiration and thrombectomy, they have the same effectiveness. So we've been using both for surgery. And this is when you have the clot and you have the stroke, and you're gonna do the imaging, you're gonna do a CAT scan, a perfusion, and after that you're gonna indicate the treatment. So it was a game changer since 2015. And after I finished my endovascular fellowship, I moved back to Volta Redonda, my city, and I started work in this private hospital called Unimed Volta Redonda, one of the biggest private hospitals here in the region. And I was able to be the first one to introduce the thrombectomy to the
Boa tarde,
hospital.
pessoal.
This is
Tudo
just a
Christian,
video
estou
for
aqui
me.
direto da
I don't know if you
hemodinâmica do
can hear
Hospital da Unimed.
the
Para quem não
audio
tem
of
a
the video, but
oportunidade
it's in
de vir conhecer o
Portuguese. Sorry
setor,
for
eu queria
that.
mostrar o setor para
But this
vocês
is just an
entenderem como é que a
opportunity
gente
for you
faz o
guys to
exame
understand
na
how
angiografia
it
cerebral e também
works
cateterismo
and how
coronariano,
we do all
exames
the
vasculares da
exams,
aorta e
vascular
dos membros
exams,
superiores e inferiores.
and you can
Então essa
do
daqui
in
é a
the angio
mesa.
suite. So
A mesa é uma mesa que
the angio
ela é
suite
rádio transparente, ela tem uma
a suite
mobilidade, a
prepared
gente
for
consegue controlar ela com a
radioscopy,
manopla, tá?
fluoroscopy.
E a gente
So you
consegue
have
fazer
this
diversas
radiolucent table
posições,
that you can
tanto a
control,
P
and
como
you
o I,
have
com
the
perfil,
C arm
o
who
ácido
delivers the
bem móvel,
X-ray, and
né?
you can see
A
the
gente faz
movement
essa
of the C
reconstrução das
arm, and you
imagens.
can
A gente pode
position
comandar a
as
mesa
you
pelo
want,
pedal.
and you can also control the
Então,
table from
solta a mesa
your
aqui no
feet.
pedal,
And there's this
facilita
pedal,
a
you can
movimentação
release the
dela.
feet, and
E aqui a gente faz a escopia,
you can
e aqui a
activate
gente
the
faz
X-ray
a
through
escopia, é o raio-x puro, e aqui faz a subtração digital.
the
Não vou
pedal.
fazer porque eu estou sem a
And
proteção do material
Dr. Ferreira,
de raio-x.
sorry,
yes,
A gente
could
também
you
tem um
pause the
escudo
video so that I could hear you
para
a little bit
proteger
better?
contra o raio-x. A gente pode...
sorry,
I know
I
you're
don't know
good.
how to I don't know how to mute the video. Let me try to decrease the volume. It's annoying when you're using the Keynote for videos.
All right.
Tudo bem?
Yeah.
Boa tarde, pessoal. Aqui é o Dr. Christian. Estou aqui direto da hemodinâmica
Let
do
me try to show the video here so I can scroll through the video and without audio. You can also see my screen, right?
Okay. Yes.
Yeah. So I'm just gonna go forward here and show you guys. So this is the how we control the table, this fluoroscopy table, and we have this protection, and we have all the screens. You can see all the images. So this is me preparing myself for a procedure. So just playing the video without sound. So this is when we do the puncture. This is I was doing a cerebral angiogram through the radio artery. Here we have the puncture kit, and after a local anesthetic, we push a sheath inside the radial artery, and you can see the little autofocus. But as you can see here, the sheath go in the arm, and after that we give some medication through the sheath. So we prepare the vessel for the procedure, and then we go with the catheter. And this is a pre-shaped catheter called Siemens, and you can format the catheter inside the aortic arch, as you can see there, and you can take pictures from the brain through the angiogram and through the catheter, sorry. And then you inject the contrast. I was doing a 3D excision here. This patient had rupture aneurysm. It was just a follow-up imaging because it was a small aneurysm. And as you can see here, we inject the contrast. The machine is going to take pictures, and as we finish the rotation, you can see the 3D reconstruction over there. And we can post-procedure, we can analyze that. You can see that the machine can do like CAT scan like imagings. You can see like a CAT scan, a tomography, and then you can do reconstruction with the imaging to better understand the vascular anatomy of the brain. So I had the opportunity to create this first stroke center in the interior of the state of Rio de Janeiro, and we implemented that. We was treating strokes in patients because of this unit that we had, a training of all the ER team, of the neurology, and we could do thrombectomies and also do aneurysm and AVM treatments. All of cerebrovascular malformations we could treat through the angiogram. So this is just a quick video showing how is the daily work at the angiogram, at the angio suite. And but when I was like working over there, and then 2020 came, and with that COVID. and that was definitely a very important year, and for me and for everybody, I think. And at that year, I had to stop working, and my wife and I, we had our second daughter. This is a picture of her in the first day. Everybody using the mask, covering the mask, and was very scary that moment to have her in the hospital. And we just stayed in the hospital a couple of hours, and then we left. And I stopped working for a couple of months. I was just taking care of my little one, Marina, who's now 4 years old, right? And because of that, I had a lot of free time at the beginning. So it was like at home taking care of my two daughters with my wife. We didn't have any help from our father-in-law, mother-in-law, and we're just us without a babysitter because everybody was scared about COVID. And also I was doing emergencies, and I had to go to the hospital and work a full gown with the shield, with the two masks to try to treat patients with COVID. We're having like, this is an AVM patient, ruptured AVM patient that we had to do in a treatment. And it was a pretty scary year. And that year I with that experience that I had in Jacksonville, in Florida in 2015, I always wanted to come back, but I never had the opportunity to start studying. So because of COVID, I had more time. So I started my clinical fellow plan, and then we started as studying. I prepared myself. Marina was born in 2020 in May, and for 6 months, we were just taking care of her, doing emergency surgeries. And the vaccine wasn't here in Brazil. It took a little longer than the US, and it was very scary at the beginning. Everybody was like worried about that, and I thought that if I could go to the US, I have more. We could have more access to the vaccines. We have more better opportunities, and it was one of the reasons that I wanted to start studying, and I had the time to it. So I started studying in 2021. I was like a couple of months preparing for the study, understanding what did I have to study, what books, what questions bank, U-World question bank, and then I started studying June of 2021. And I was studying 4 hours per day. I was doing my routine, taking care of my kids, doing emergency surgeries. And at least from 7 p.m. to 11 p.m., thanks to my wife, who was taking care of the kids at that time, I could study for 4 hours per day. And I was reviewing a thing that I learned in my first year of our medical school. And it was 2021. And my first year of my medical school was 2004. So it's a long time. So but I had to review all of the biochemistry, vitamins, all of the stuff, and study 4 hours per day. But if you want, you can do it. If you have grit and if you have willpower, you can make it. And I did. And the first step one, I got the first test in January 2022. And I was approved in the step 2 CK on July 2022. And I took the ONT, who's the English proficiency test, and I got the ECFMG certificate in October. And that was my victory that year. I was like investing all of my free time on that, and I managed to do it in 1 year and in 14 months. And then after that, I started applying for a couple of fellowships, because you have to get to the some interviews. And then when I got the opportunity to do the interview with Dr. Langer, amazing guy, and fortunately we had a match. And then I did my step 3 in 2023, preparing to go to the fellowship. But I already knew that I was going to Lenox Hill Hospital, and that was my perfect match. And I had the opportunity to meet this guy and do procedures with him, and we learned a lot together. And mostly I was learning a lot from him, but he knew a little bit of Brazil because he hadn't ever had a fellow from Brazil before. So I think it was a great experience for both of us. And after that, here I am with my graduation, my diploma. This is a picture of me in the OR with the techs and the residents and the anesthesiologist, and on the right side, the neurosurgical team. We're missing Dr. Langer here. And but these guys are amazing. They gave me the biggest opportunity of my life, and now I'm staying. And it's great to have this opportunity. I stay in one more year. I'll be working at the Phelps Hospital with Dr. Cerulli and Dr. David Gordon. And that's it. And I think you are never too old to set a new goal or to dream a new dream. So I was more than in 2022. I finished my med school in 2009. So it was like 13 years after finishing my med school. I decided to take this big step of my life, and I made it. So I think the biggest lessons here is that you if you have the opportunity, if you have the grit, the willpower, you can achieve anything in this world. So thank you very much.
Yes, thank you so much, Dr. Ferreira. Very educational. Loved hearing about your journey. So we're gonna do questions, if that's okay with you. Brain turns, if y'all want to go ahead and start putting in your questions in the Q&A. And I guess while we let that come in, I know a lot of the questions that people had in other sessions, which I think would be more applicable to ask you, was if you had any tips about like research opportunities as an international student.
Oh, sure. Yeah, you definitely need that. So research is a big thing. Especially if you want to go to residency in America, you need to work on research. Yeah, because it's a must, right? So you need a couple of papers published, and but you can the best way to get on this is going to conference. Go to conference, get to know people, ask for opportunities to write a paper with somebody who's a more senior, going to be a senior author for your paper, and going to be easy for you to get the paper published. So I think the first thing is going to conference, get to know people, and publish papers with more experienced ones, and it's going to be a game changer, especially if you want to go for a residency. For a fellowship, it matters, but I think it's more like networking and all of your previous knowledge, your experience with surgeries. And I had a lot of experience with surgeries because I finished my residency in 2015, so I had like 7 years of my own patients. It gives a lot of confidence when you want to do surgeries. And when you just finish your residency, it's totally different. So first couple of years of after your private practice, dealing with your own patients, you have to learn a lot still. So I think I already had that step a couple of years ago, and it prepared me a lot for this fellowship.
Yeah, for sure. Are there any like research or clinical opportunities that you had pre like residency that you really enjoyed or like had an impact on you?
Oh, definitely. So that internship that I did at Beneficência Portuguesa de São Paulo was a great opportunity. It was nothing related to my med school. I looked for it by myself. So you have to. Of course, there's other ways you can get some courses and know people, but you have to go for it by yourself if you want to go somewhere. If you're having a goal, you're probably gonna need to look for yourself. And I was just like, okay, I'm gonna email this guy from Beneficência Portuguesa and ask him if I can go there, and they approved. Of course, they said, of course, Christian, you can come. And then I have all the documents for that, and they exchanged the documents, my med school with Beneficência Portuguesa, and everything went fine. So if you're looking for it, probably people gonna help you. If you It's the same thing. We have a lot of observers in Lenox Hill, and it's great to have people from all over the world to come and watch and learn with us and email us. So I think it's just by email you can get there. Yeah.
Yeah, for sure. So a lot of just being proactive and reaching out. There's a question about if you know how an international undergraduate could seek and participate in conferences.
Oh, of course, you can go by conference by yourself, and there's always like you can apply for grants. I got a couple of grants during my career to go to international conference, and it's a good way to travel to US, for example. For if you're from Brazil or other countries in Europe, you can apply for grants. There's some sections in some conference that you can apply for grants, and you're just gonna put your resume, your interests, and what you want to do with your career, and probably you have a great chance to getting a grant. I got a couple of grants to go for Miami, to go to Washington D.C. for a conference, endovascular conference. I was traveling for free. I was staying the hotel they would pay for me. It was great. It was a great opportunity to know people. And in one of those conferences, I got the opportunity to talk with Dr. Ricardo Hanel and to Dr. Adnan Siddiqui, and to know these famous guys from the vascular field. And they gave me the opportunity later doing for my interview at my fellowship. So of course you need to try to go to conference. Yeah. And as an international student, you can apply for grants if it's too expensive for you to travel.
Yes, for sure.
I saw the question here. Okay, let me see here.
Yes. I think with the grants, if you're just looking and being proactive of finding the conferences, you can probably see all the information on grants for that specific conference.
Yes.
There's a question about how challenging it was to balance between family and COVID and your career, if you want to talk about that.
Oh yeah, definitely. Yeah. So during COVID, I was doing only emergency surgeries, right? And I had to go to the hospital to see some of my patients in the ICU too. So for the first year, it was pretty challenging because it were just me, my wife, and the two daughters. And every time I got home, I had to like shower, change clothes outside before going in, and everybody was doing that, and it was pretty challenging. So the first couple of years, from 2020 and to the mid 2021, I was doing just that. I was trying to understand how I was going to study for the steps, and I only started studying for the steps in 2021, late 2021, and then we had the vaccine already, and so I could like be more comfortable in relation with that. I had COVID 3 times. Thank God I'm still here. But I had COVID 3 times, but I also I like to practice sports, to play tennis, and I think I'm a pretty healthy guy, so it helped a lot too. So, but it was challenging. And my wife, she's also the physician. My wife, she's an ophthalmologist, so she was working too after 2021, after like 6 or 7 months that we had Marina, and was pretty challenging, but we had a more help from my parents-in-law during that time too. So, but it was like challenging. I was getting home late. We had dinner around 6 p.m. and then I would try to put the kids to play with my wife from 6 to 8 p.m. and they usually go to sleep at 8 p.m. So then I had like this quiet house for 8 to 11. So it was reasonable, and my wife is doing a great job, so I own her a lot. Yeah.
There is also other questions just about if when you're talking about your the intra-arterial thrombosis in Brazil, they were asking if you were one of the first surgeons to perform that.
Yes, definitely. So in 2015 that we had the first trial, okay? And before that, no other insurance or in public health you could do that because they will never pay you for that. And after 2015, when the first trial, Medtronic was a big company in the business, was the sponsor for that trial with the stent, and they had this course in Brazil. And I trained thrombectomies in pigs in Brazil. You can do that, animal training labs, and we did animal training in pigs at the end of 2014 already, because they knew that 2015 the paper would come out and everybody would start doing it, because as soon as the paper come out, you could do that on private practice in Brazil. It was a challenging to go to public, and there's still a couple of cities in Brazil that you don't have access to thrombectomy in public hospitals, unfortunately. And it's also a Brazilian called Raul Nogueira, who is a famous neurologist from his work in Pittsburgh now. He was from Emory University in Atlanta, and he published this paper, and that we should do it in public health in Brazil because it's going to be cheaper comparing patients that did thrombectomy to without thrombectomy. And it was a great paper, very famous paper here. And after that, they started approving that in the public health system in Brazil. It's pretty different because in Brazil, only 30% of people in Brazil has private insurance. for med school, for health. And in America, I think it's 95%. So it's huge difference. And the other people in Brazil, they need to go to public hospitals, and public hospitals, you don't have access to thrombectomy still. That's why we're a third world country still. So but in 2015, I did my first one in a private hospital, and I was definitely the first one of my city. I don't think I was the first one of the Rio de Janeiro state, but because my boss in my former boss back in when I did my training, Dr. Orlando Maia, he was one of the first ones to do endovascular treatments for aneurysms in Brazil since 1990, 95 something. And he was the first one who did the first flow diversion stent for aneurysm. So he probably was the first one to do a thrombectomy too in Rio de Janeiro city. But if my city, I was definitely the first one. And after that, we implemented the stroke thrombectomy protocol in my private hospital. Yeah.
Yeah. Okay. There's also a question about coming from Brazil to the US must have been a culture shock. How did that have any effect on your academic career? Or I guess
Uh,
personal.
yeah, personally, I think Brazil, we import a lot of stuff from America, so we have access of your sports and all of the other stuff like clothing and stuff like that. So and food and so that we live in a globalized world, so it wasn't that challenging at all adapting to food or the way you talk and stuff like that, because we watch American movies, so I don't think it was a problem. Besides that, on my career, going to the hospitals and working, it was a challenge because I was working at my own. I didn't have a boss anymore, so nobody was telling me what to do, and it was hard. It was pretty hard, but you have to be mentally prepared to go through that. And I was accepting everything. I was learning. I read a book from Bruce Lee, the famous kung fu fighter, and there's one quote that he said, "You always have to have your glass of water half empty or half full, because you never know, you're never gonna know everything, and you need to let people teach you, even if you already know how to do it, because there's one way to do it. There's more than one way to do it, and you have to be respectful of what people are telling you." So I was like that. That was my philosophy for this year. I'm gonna be like half empty to learn everything that I could, and I was adapting, and I had a lot of help. People were amazing to me. All the PAs, the nurses, uh, all of the staff in the neurosurgery department over there, they are amazing. They are amazing, and they helped me a lot. They understood that I was coming from a different country with a different culture in my work environment, and they helped me a lot to adapt. So thank to them, I adapt pretty fast. I think after the first like 1 month, I was already okay. I know how to do it, and thank to them. So I think New York too is a pretty open place too. I don't know if it's gonna happen in other places in US. I don't know. You have to tell me.
Right, yes. There is such an awesome team at Lenox.
Yes. Yeah.
But there is a lot of questions going back to research and like the grants. A lot of them are wondering like how you found them or how they're advertised. I don't know if there's like a certain resource that you use, or if for you, you just kind of like look it up on the internet.
Yeah, basically looking up in the internet, and most of this conference, they have their own Instagram page, and they post that. For example, the WLMC, it was a famous endovascular conference that they just had this year at Turkey, and so I don't know where it's going to be the next one, but get to their website and wait for it, because you're going to have the opportunity to apply for grants. If you're like a medical student, if you are a nurse student, you can apply for grants, and you have to email them. Okay. And the research opportunities, I think, was pretty much the same, because I was in the university environment, because I was doing my residency in a university hospital. So I knew a lot of people because of that. A lot of people doing like the master's degree over there, PhD over there. And then we got to know a lot of people And if you're in a good environment, you increase your chance of publishing or and meeting people. And the internet today, come on, you can do everything with that. Yeah.
Right, for sure. So make sure you guys are being proactive, looking around for just opportunities to make those
Yes.
connections. 'Cause you don't
Yeah.
necessarily just start with a connection. That's how you get the connection. Um,
Uh-huh.
there's a question that asks if you were to do another degree in addition to medicine, what would that be if you were to?
Uh, I know a lot of people who do. For example, we have one of our research fellows in Lenox Hill. He did veterinarian. I'm sorry. I think that is
But
the degree, right? Yeah. So he did 5 years of veterinary school, and then he said to himself, "I know I want to do med school," and he started doing med school. And if you're doing what you want, you really want to do, if you still have the grit, of course you can do it. And I always had that in my mind because me as a neurosurgeon, I was like, I always have to be like my body, my mind, my ability with my hands. They are so important. But if anything happens to my hand, if I have an accident, I love playing sports. So my wife's like, you're gonna break yourself. You're gonna break a leg. I had a couple of injuries playing soccer, so I had my knee surgery, and then I had a shoulder problem too. And I was like, all right, if I had to stop being a neurosurgeon, I'm definitely gonna do it. I'm probably gonna go through a training again. I would apply for a residency in radiology or something that is not that important to have a eye-hand coordination or control. I'll probably go through it again. You're
yeah.
never too old. I'm 39. I don't look like I'm 39, but thanks to my genes, my mom's genes. But I would do it again, of course.
Yeah.
Yeah.
What would you say that was like the biggest thing that you've learned this year in this fellowship with Dr. Langer?
Oh, geez. One thing, just one.
I mean, it could be a main theme.
You're gonna kill me with that question. Oh, he's such a nice person. I learned how to be. I have to thank my mother too, because my mother, she's an English teacher, so my English is kind of reasonable because of her. But she taught me a lot how to be a good person, and how to deal with people, because you're dealing with people is different when you're dealing with machines or whatever. And Dr. Langer, he's one of the best in that thing. It's pretty common from Brazilian. I think the Brazilians, they are more, I don't know how to express that in the right way. Calorous, or more like to give hugs, kisses. We love touching each other. We don't care. We respect, of course, we respect each other a lot, but we are more like into it. So all my patients will be like giving me hugs, kisses. They always want to give me gifts and stuff. It's like, okay, you don't need that. But I think it's more from the Brazilian way to be, right? And Langer is like that. And I heard that there's a different type of people in America, and people like more direct, and you're more scientist, right? So you have more the scientific approach to people and to disease, and you do that. And it's different when you're doing like a terrible disease that we do all the time. Same thing as Dr. Bookfor was an amazing guy with his patients, with like cancer patients who are gonna die in a couple of years, a couple of months, and you have to deal with them, and always have to show them positivity and respect. And with Dr. Langer, I learned that. I learned how to. One thing that I never did before was like this mindfulness moment that he always does before his surgeries, like stop, breathe, close your eyes, 10 seconds, and it puts you in a better place to start surgery. I noticed that. So I'm probably going to do that for the rest of my life. And and of course, the technique. It's a lot of things in techniques, but I think the most important part is like how to treat patients, and how to be like this heartful, and heartfulness, and always thinking about how patients are understanding you. So
Yeah.
yeah.
Sure. There's some questions about how, and this was also a question yesterday, but for if you had any like tips or for how you combat like comparison, but also like not feeling good enough, if you ever experienced that.
Sure, of course. Of course. My first surgery with Dr. Lang, I was shaking. I was like, what the fuck? Sorry.
No, you're good.
I was like, yeah, I said, no, I'm doing this by myself for 8 years. Why am I feeling like that? It's normal, guys. Come on, it's completely normal. So when you start over and people are watching you, a lot of people, different people that you don't know, you start to question yourself. Am I good enough for that? And it's really challenging to have your mind in one piece to go through that. But I think is the more you do, the more confident you get. So I think experiences means a lot. But you have to go through that. You have to have no's in your life. You have to commit errors to understand and to learn with them. And but if you don't expose yourself to that, you're never gonna learn. So go through that. It's the same thing. And I always tell my daughters, she's always like, I'm scared, I can't do that. If you never try it by yourself, you're never gonna learn. So you have to learn how to deal with that, knows, and to have a couple of regrets. Why did I do that? Oh my God. But you have to, because you're gonna learn for the next step. And for the first couple of surgery was like that. Oh my God, I'm gonna this American patient here. I'm gonna kill this patient if I do something wrong. I'm never gonna go back to Brazil. I'm gonna go to jail here. I was like, oh my God. And then you realize that no, it's the same thing you're doing in Brazil. So and and after you put the blue towels and you put everything in the patient, it's the same thing. So you just have to put in your mind and remember that, okay, it's just the same thing. You can operate the Pope or the president, it's gonna be the same, it's the same thing. Or your mother, you can be the same thing. You have to put yourself together. After you put the blue towels, it's your same routine. Don't go off your routine. So yeah, but you have to expose yourself with that.
Yeah. How would you say, like, when obviously residency is really hard, fellowship's really hard, and there's just, certain situations with patient outcomes, how would you say, or I guess what would you say is the thing that drives you to keep going, despite the difficulties that can arise?
Um, there's always like a greater uh, part at the end of it. So you always have to think that it's temporary. And that was my plan when I first got there in US for my fellowship, because it was like I was already trained, I did residency, I went through a lot during residency, and then through my fellowship, like moving to different hostels, and I was driving a lot. It was a terrible experience, but I had a date to finish that. So I was just thinking that the day after that. And it was the same thing with my fellowship. I learned a lot. I stopped earning the money that I was earning in Brazil, because in Brazil I was making my own money, and compared to the fellowship, what they pay for the fellowship was less, and it was not just, it was a financial decision to take it. And I said, okay, I'm gonna go back. I'm gonna have people telling me what to do. I'm gonna have they're gonna pay me less money that I earn today, but I had this other part. It's gonna be the amazing experience. I would have this opportunity to practice my English, to learn different people, to live in a different country that I never had before, and to have better opportunities to my daughters too, because they can go study. And my daughter, she was like speaking Portuguese, and in 9 months she learned how to speak in English. She was a first grader. My Isabella is a 6-year-old, and in 9 months she learned how to speak English. I was like, what? And it's amazing. And it was like the best experience we had. And there is no money, there is no other thing that will pay for that.
Yeah.
So, but I was thinking there is an end date, and as I finish my fellowship, I could just pack and go back to Brazil and go to my normal life. Okay, but they offer me a second year of fellowship, and start working as an attending for stroke calls. And I said, okay, I'll give one more year, and I'm putting all of my coins here again. I'm doing all in the poker because there's a better opportunity at the end of it. I'm gonna suffer for a couple of years, yes, I will, but I have the opportunity to change my life in 2-3 years,
Yeah,
right?
for sure. Somebody asked what your favorite part of the job is.
I love treating aneurysms. It's like, sounds weird, but the feeling that you have after you accomplish, like you clip an aneurysm, or you coil aneurysm, or you do a bypass, it's like, I don't know, it's beautiful to see that. I always love to do handcrafting things with my hands, and I have like a good feeling about that, doing that. And after you see the results, because that's why I'm a vascular surgeon. Vascular surgeons, they usually cure the patient, and you can feel that you really change that patient life. And 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 when you treat an aneurysm, a rupture aneurysm, the patient is going to die, and you can save that patient life. Or stroke patient, do a thrombectomy, the patient is going to get a terrible result, and the patient's normal. Or even though if it's not that normal, but he survived that. So you have this greater feeling I can't explain. So it's really good to help people, and also to do things, like to practice and do things with my hands. I have this feeling of practicing and using my hands to accomplish things. I don't know how to explain that. But yeah, definitely helping people. It's the mantra. Everybody says that. I love helping people. No, I have pleasure operating on people. So what? But and besides that, we were helping people too. So
Right, for sure.
but no. But yeah. It's like I don't know how to say, a vocation. I don't know. Sorry, I'm missing a couple words. Yeah, but that's it. Yeah.
Yeah. Speaking of like, I guess more on the vascular side, somebody had asked like why you chose vascular and like how you knew you wanted to pursue that, I guess, over like the other options like neuro-onc and like skull base.
It's all about opportunities too. It's not just about love and what you like. And when I was finishing my residency, I knew a lot of people back in my hometown, Volta Redonda, and I knew that they didn't have a vascular surgeon that good over there. So I saw that opportunity because I wanted to live there and I wanted to work there. And one thing came together with another. And of course, I love vascular surgery already doing residency. But if I had the opportunity to get a job in my hometown as a spine surgeon, I probably would go for a spine fellowship. I think you have to think really good about it. I know all people want to do what they love, what they like, but sometimes you can't. I had that talk with Dr. Langer, and he told me that about his decision to do vascular surgery was about the same. He had the opportunity to go to vascular at that moment. You can ask him later. You can ask him later. But he told me that I had the opportunity to go to vascular. I saw an opportunity that I could grow in that field, and it was the same thing for me. So if I had the opportunity to go neuro-onc or spine surgery, I probably would. One of my best friends who's a spine surgeon in Connecticut, he finished his residency in Rio, same thing, came back to Volta Redonda, and he had the opportunity to be the best spine surgeon here, and he decided to be a spine surgeon, and he's now one of the best spine surgeons that I know. And he went for what the opportunity showed him. Okay.
Yeah, for
So you have to think about that when you're choosing what you're going to do with your life. Yeah.
Yeah, for sure. Somebody had asked if you know if there are opportunities available for doctors from areas like in more political conflict areas to get into neurosurgery residency programs.
Of course. They don't of course, if you can get the ECFG certificate, if you get the validate your diploma, your medical school diploma, and you can do research, you can apply for a match. And you can also try to come to US to do a 1 year of research. There's a couple of places there's a lot of places in US that you can have a salary to do research. So I have this Brazilian friend who's just starting a research fellow at Emory University, and he got a grant. He's gonna get a grant for 1 year for research. But he applied. He knew people. He started publishing. He knew people from conference. He emailed a lot of people. He emailed Dr. Raul Nogueira, the one that mentioned about stroke. Dr. Raul, I want to do that and that and that and that. People gonna read your emails. And then he said, I'm publishing this paper. Do you wanna join? And Dr. Raul joined him for a couple of papers, and they published together. And that was the way he got to know Dr. Raul. Dr. Nogueira, and Dr. Nogueira gave him a opportunity to do a research fellowship in Atlanta, and he's there right now. So of course, it doesn't matter where you're from. If your med school is on the ECFMG system, you can look for that in the ECFMG website. You can look if your med school it's on their system. If you are, you can do the tests, you can validate your diploma, and you can apply for a residency. It's gonna be hard to get a position as a residency, a neurosurgery residency, or wherever, because you're coming from a different country, people don't know you, so you need to do some networking, you need to do some papers, okay, and maybe even they'll come to the US to do a research fellow. Sometimes they don't pay you for a research fellow, okay, and you have to do it, and you're gonna have to find somebody to pay for it. It's hard, I know. And in Brazil, you can start working as soon as you finish med school. So the first day I finished my med school, I could do like a ER. I could work at an ER. I could work in a family clinic, and I could like save some money for a couple of months. And with that money, I could pay like for 1 year to be a unpaid research fellow in somewhere in the United States. Yeah, we can do that.
Yeah.
And you finish the med school so young in Brazil. In Brazil, I think in England, it's the same thing. A couple of Europe places like Germany, I think it's just 6 years straight. So you can finish and start working and save some money, and then you go for your dream. Okay.
Yeah, for sure. To wrap us up for today, is there any like advice just like that you have for these med students or these high school students or these residents, just anybody who could be watching today that wants to have a career in medicine?
Of course, I think it's you're never too old to try to go for your dreams, and you have to have willpower, and to work on that. I think you should like um, stop dreaming and start working. I think somebody sent me a picture today with that, and it was like you have to put together a plan. There's a lot of help in the internet that you can research. I learned a lot. I didn't pay like for a course or something like that to prepare myself for the ECFMG. I was just like researching by myself, and you have to look it for yourself. And if you dream big, you can get to it, and have willpower and have patience too, of course, because it was a plan that I start thinking about it. The first time that I was like, oh my God, should I come to the US? It was 2014 when I was doing my researchship in Jacksonville. Should I come here? Not, I can't right now. So I come back to Brazil, fellowship, marriage, kids, all this stuff happening. And COVID came. I was like, oh my God. And I had the opportunity in that moment. Okay, I'm gonna research. And for for 3-4 months, I was researching. What should I do to get to America? And I learned a lot, reading. And then I started studying, and I had a plan. And before I had a plan, I already knew whatever every step I would take to get to my final objective. But I knew it was like a plan that I started in 2020, and I got an opportunity in 2023. It was 3 years later. Okay, but I think if you have a plan, a good plan, and a willpower, you can get there.
Mm, of course.
Okay.
Thank you so much. It was so inspirational. Literally, I know I feel inspired after today in your talk.
Thank you.
Yeah, so everybody could say thank you to Dr. Ferreira. Is there a way that they could, I guess, contact you or follow you on if you have an Instagram or something?
Yes, I do. I think Christian.ferreira.md on Instagram. My email is christianferreiramd@gmail.com. This is my personal email. And my Northwell email is cferreira6@northwell.edu. Maybe you can put in the chat, they can have it.
Yeah, if you want to just put in whatever you want them to contact you with, that'd be great.
Mm-hmm.
Yes, it was really inspiring.
Okay.
So thank you so much.
Sorry not to answer all the questions, but I think it
No,
was
I think we
pretty
got
good.
to all of them.
We got them? We got
I
them?
think
Okay,
so,
great.
yeah. Yeah, thank
Okay,
you so
great.
much for taking time today in your busy
Yes.
schedule to come talk with our brain turns.
Yeah. And of course, always try to do whatever you like to do. You can see here my guitar. This is one of my loves here. And it was like my way to go through everything. I was playing the guitar, doing sports. Take your own time. You don't need to do everything at once. Take your time. Okay, guys.
For sure. Thank you.
Bye.
Bye.
Yeah.
Thank you. Brain turns, I'm gonna talk about tomorrow really quick. I'm gonna share my screen. Sorry that it's already 12 o'clock, but oops, sorry. So tomorrow is going to be, we will have medical school applications with Dr. Joanne Wiley, and she is a part of the Zucker School of Medicine. And then we will have a cerebrovascular virtual OR with Dr. Sorelli. And then at 11 o'clock, we will have the neuroplastic and reconstructive surgery talk with Dr. Ben Shalom. So I hope you guys enjoyed today's talks. I know, like, especially this one, I felt really inspired by Dr. Ferreira and just like his journey. And he's so right of like, it's never too late. So if y'all want to also go ahead and follow the Facebook group, we are communicating through that. There is also the Slack channel that you guys can join. I'm currently waiting on getting admin access on the Slack. So a lot of my announcements will be coming more towards Facebook than on the Slack. But I would still join the Slack for future things. And then don't forget that we have the t-shirt design contest if y'all are interested. But thank you guys so much for today, and we are excited to see you guys back tomorrow.
Guys, don't forget the t-shirt contest closes tomorrow. So if you want to get that in, make sure to do that by the deadline. We're so excited to see you guys all tomorrow.
Yes. Thank you guys.
Bye, everyone.